Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Over the last several weeks, we've talked a lot about thyroid, in particular Hashimoto's thyroiditis. The reason is Hashimoto's thyroiditis is the #1 autoimmune disease in the world, and it impacts so many Americans, right? And people don't understand how it really works. It's an autoimmune disease. It's not necessarily just a thyroid problem. Oftentimes you can't medicate your way out of all the symptoms that come along with Hashimoto's thyroiditis. However, sometimes medication is needed. So I want you to look at the diagram behind me, and I'm just going to explain how things will work in our office and how we can help patients navigate this path to recovery, okay? So when we look at this, we look at the clinical management of Hashimoto's. Let's say a patient comes in and they don't want thyroid hormone replacement, but it's really early on in the diagnosis, and they may never have to go on thyroid replacement hormone. However, if someone comes in and they've been on thyroid replacement hormone for 5 years, 10 years, 20 years, right? You can't just take them off the thyroid hormone and say, you're going to be completely better and we're going to do everything naturally. You have to be able to monitor that TSH, or thyroid stimulating hormone, and make sure it's not going too high. So thyroid replacement hormone may be necessary for some Hashimoto's patients to recover, right? Because you need the thyroid hormones. If you're lacking thyroid hormones, it's going to just slow everything down. So in our office, what we try to do is do some natural alternative therapies and monitor the TSH, and to see if we can get improvement or some sort of stability in that number. If it continues to run high no matter what you do, then that patient may need thyroid hormones, right? It's inevitable, right? Because if you don't have it, then the other things that we do in our office may not work for you, okay? So thyroid hormone replacement may be necessary for Hashimoto's thyroiditis. Not in every patient, but if you have long-standing Hashimoto's or hypothyroid, then you may still need the thyroid hormone replacement, okay? The thyroid hormone replacement that's usually the cleanest is something called tyrosine, right? It's a pure T4, synthetic T4, right? I know there's other practitioners who will use bioidenticals, right? Things like Armour and so forth. But if you want a pure synthetic T4 with no other fillers, tyrosine might be the way to go. Obviously, you have to talk to your primary care physician or endocrinologist to get that prescribed to you. The other thing about Hashimoto's is that you have to be able to remove the triggers. In the past video, we talked about all the different types of metabolic conditions, right? You have to be able to remove the roadblocks. If you have blood sugar problems, you need to correct it. If you have dysbiosis, you have to correct it. If you have intestinal permeability, correct it. If you have hormonal shifts and fluctuations, have to fix that, right? Because you don't want that to impact the thyroid over a long period of time. So removing triggers for Hashimoto's thyroiditis is very important. And then looking at what we call the physiological web is very important. So balancing the web. What's impacting it? What's pulling on it, right? Is it BPA? Is it chemicals? Is it lead? Is it mercury? Is it infection? Is it stress? There are so many things that are interplaying into this Hashimoto's web that we need to figure out and map out what the triggers are and how do we put those triggers into our web and then pull on the web and figure out what the right balance is. You have to remember, when you have Hashimoto's thyroiditis, you have an autoimmune disease. We do not cure autoimmune disease. We help to manage autoimmune disease. That's not to say a patient who has Hashimoto's thyroiditis and comes to our office will never have a flare-up. They will most likely have a flare-up, right? Because of life, stresses, food exposures, etc. Our job is to minimize that and educate the patient to teach them how to minimize the triggers and look at the physiological web and educate themselves about what's right and wrong for them. So when we look at a patient, we ask the question, do they actually need a replacement hormone, right? And we'll work with your physician to do that. Then we say, what kind of triggers are there for this patient, right? You have to individualize it. What kind of triggers are there for this particular patient? The next thing is you have to start balancing the web, right? If it's pulling too hard to one side, you want to be able to balance it out. So we talked about insulin web or glucose web with Hashimoto's. We talked about herbicides and pesticides and chemicals, right? We talked about stress, dysglycemia. You have to balance all these things out for a patient who has Hashimoto's to feel better, right? Again, it takes time. It's not a quick fix. It's a lifestyle change. It's not a diet. You have to do all the necessary things to help yourself, right? So it's not one thing, but it may be several things in order for you to get back to feeling the way you should, okay? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.